Welcome to the Healthy Hair Podcast. Your host, Dr. Amy Brenner, is a board-certified OBGYN with additional certifications in functional and integrative medicine. This podcast is meant to help women find reliable, relevant information to help them feel better, look better, and live better. Here you will hear in-depth information about hormones, sexual medicine, aesthetics, cosmetic gynecology, and functional medicine.
Hello, everyone, and welcome back to the HealthiHer podcast. Ready, set, glow. That's what we're going to be talking about in the next few sessions of how to get glowing skin. I got this idea of how to talk about or what to talk about for glowing skin is my 16-year-old daughter came home one day this summer and said, "Mom, I need a summer glow up." And I was just like, "What are you talking about?" And she said, "Well, I've just been on Instagram and people are talking about a summer glow up. So what do you have at your office where I can get glowing skin?" And it just made me think like, this is a whole other aspect of how to look good. And, when you're looking at aesthetics and facial beauty, we all know like fine lines, wrinkles, sagging skin, sunspots, that all kind of ages your skin, but also having dull skin or not glowing skin gives you a aging look. So I thought we would do a series on how to get glowing skin. And what glowing skin really is how the light reflects off of your face. And as we age, it just doesn't do that as much. If you look at an adolescent skin or a baby's skin, you will literally see that their skin is glowing or radiant. And as we age, we can lose some of that. So today, I'm really excited to talk to you about one of my favorite ways to get glowing skin, and it's called the CO2 lift or Carboxy Therapy. We recently added this to our Medi-Spa and our medical practice, and I've had so many staff members say, this is probably one of the best things that we've added in a while. And probably for the first couple months, we couldn't even keep it in stock. We were constantly running out and having to place new orders. So today, my special guest is Lana Kerr, and Lana is the CEO and founder of a company called Lumisque, the maker of the carboxy gel called the CO2 Lift and the CO2 Lift V, which that'll be for another day. So welcome, Lana.
It's so good to be here, Amy. Thanks for having me and for inviting me.
Oh, we are so excited. And I just absolutely love this product. I've used it probably about 6 times myself on my face. And my face just the next day, I'm like, you need to touch my face. Like my face feels like a baby's bum. And if the listeners go and see what you look like on your website or on any of your patient marketing materials, they will see you and see how beautiful you are and say, like, I want what she has.
Oh, thank you so much. I really owe it all to the CO2 lift gel. And I guess we'll get into that and talk about how it has affected me. But yes, thank you so much for that wonderful compliment.
So how did you start this company, or how did you even get this idea? Because this product is really unique. I don't know any other product that is even remotely similar to the CO2 lift.
No, it's actually the first of its kind. It's the first carboxy gel of its kind. So to answer your question, how did I get into it? My background is totally different. I guess I'm a serial entrepreneur, but my educational background is in accounting. I used to be an auditor with KPMG, and then went into finance. And I've always wanted to have my own business. And growing up in Jamaica, that's what you're taught, to just kind of find something that people need and fulfill it. And then you can create a business. And both of my parents, my mother's a dentist, but she's an entrepreneur. My father, the same. So anyway, I always had a passion for, the beauty industry. A lot of my friends were models, and when I was still working, I went back to school and studied nutrition. And I thought, okay, I'm going to go into weight loss, but really focus on, helping people to look better, feel better about themselves. So 20 years ago, or actually it's more than that now, I opened weight loss clinics, and that's what we did. And we had, quite a number of coaches helping people. I personally coached over 2,500 people to get their ideal weight. Anyway, to cut this long story short, eventually we changed our direction, or changed the way we helped our clients by closing down. We had 10 locations, we closed them, and we got more in. We had one left, and we did really more online coaching. But in that one location, we decided to open a med spa and put an office for our weight loss or fat loss in that med spa. And I'm thinking, how can we make this med spa different? Of course, when you have a med spa, everyone is trying to sell you their products and say this is the best. But I wanted something as unique as our weight loss system. I was coaching a client who, she very wealthy woman. She was about 10 years older than me. She just had great skin. And I just would always ask people, what do they do for their skin? And she said she did Carboxy Therapy. And I never heard of that before. So I was like, okay, let's find out. She got it done in Europe. And
was this in the US or Jamaica?
This was in the US. So sorry,
Okay.
I kind of,
Okay.
so I moved, I moved back to the United States. I went to school, went to work here. So, a long time ago. So, but this is all in the United States, in Florida. And she said she did Carboxy Therapy, but she did it in Europe. And so I was interested in how we could get that here, because I never even heard it being done here in the United States. Well, you couldn't bring the equipment here in the United States. It was just very complicated. And so just after doing research, what our team found out was that there were a group of scientists that actually had patented a delivery system of putting carbon dioxide through the skin. And we'll talk about what carboxy therapy is. And so basically, we licensed the technology. We opened a company in Japan, and then we manufacture our product and we distribute it throughout the world, and we're primarily here in the United States. So carboxy therapy is new in a gel form, but it's not a new process. The actual carboxy therapy is just the therapeutic use of carbon dioxide in its gaseous state. And really, since the early 1930s, it has been used through subcutaneous injections. So this, over just a little over 5 years, 6 years ago now, we created the first gel application where the CO2 is delivered through the skin.
Yeah, my understanding is injection of carbon dioxide that's done in Europe is really painful.
Yes, it's painful. It has to be done in a doctor's office. You have there's some downtime. So as even though it's very beneficial for skin regeneration, there are just some drawbacks to it. But again, the results are still impressive with an injectable. But certainly no, to have a gel doing the very same thing with no pain, no downtime, that a patient could do at home, to me is just ideal.
Yeah, that's what's beautiful about this is exactly what you said. No pain or no downtime, but you also get results, which usually the no pain, no gain things don't work.
Right. I always say there's beauty is pain, but yeah, no, in this case, that's definitely not the case. It's you're seeing the results immediately. And the reason for that is, CO2 lift carboxy gel, or just carboxy therapy, it creates a natural response in the body. It's just how we're created. We exhale carbon dioxide and breathe in oxygen. So when that role is reversed, when you're putting CO2 in the skin, the body is going to respond by rushing oxygen to that area to rebalance the area. And that's where all the magic is. Amy, once that oxygen-rich blood goes to that area, the blood vessels have to dilate. They have to open the capillaries to bring that red blood cells, as well as you're talking about all the nutrition that goes along with that, as well as when you're talking about your glowing skin, the hydration. You'll see that there. And that's one of the things that we saw when we did our first set of clinicals, is that you increase the hydration over 117% in the skin by just one application. So that's why what you're seeing when a person has it on, that immediate glow, is because of that, you don't get old, you dry up. So that water, that baby's bottom that you're describing, that bouncy skin.
I hear the Jamaica in you right there.
Yes,
say
okay.
say water again.
The water.
Yes, there you go. Okay,
Yes,
sorry.
okay.
Go ahead.
Yes, you're that's what you're seeing immediately, and that's what's so beautiful about the treatment.
Yeah, so for like science geeks like me, of being a zoology, biology major, is I remember this is scientifically it made sense to me. That's the Bohr effect, where you in a high carbon dioxide environment, oxygen rushes in.
Yes, yeah, the expansion of the capillaries, and then of course the nutrition along with that. So, and then as well as the fact is that waste is going to leave, because once that those capillaries increase, it's going to release waste. And that's what is, when we talk about cleaning the ECM, or that extracellular matrix, that's why people, even with blemished skin, acne, they'll see a result. They'll release that, or after, say, doing one of your laser treatments or that's why you're getting that the redness will leave and the inflammation will leave very quickly, and then you're going to regenerate those cells quickly as well.
Yeah, so you kind of talked a little bit about what the indications are for. So for glowing skin, like you'll get a result immediately. So this is a great procedure for, like, my daughter is getting married in February. So the day of the wedding, the day before the wedding. So it's a great procedure before an event, before a weekend, before a vacation, because you get that immediate result. But then with continued use, if you can explain to our listeners what the long-term use you will see, what results you'll see.
Yes, very. So just to answer, just to say first, definitely for an event, there's no downtime. I like personally to do it a day before the event.
Okay.
But I do it on a regular basis. I do it every 2 weeks. So I still may do one right before an event, but for someone who's not a regular user of it, certainly I always still recommend 3. And that way they'll get the best result of using this treatment. But in terms of the long-term use and why it's so beneficial, is because this is about skin health. So yes, the glow is great, and of course young people like your daughter, they love that camera ready glowy filter, that the filters that they use, they can achieve that without a filter if they just keep their skin looking glowy, and that's great. But for long-term skin health, this is, to me, ideal, because what you're doing is you're increasing the oxygenation in the skin. You're increasing the flow rate and the vasodilatation. You're, just as we talked about when we talked about cleaning that ECM or that network or that scaffold under the skin, you're improving that. It's creating biostimulation of the connective tissue. It's so all of those things contribute to, increasing growth factors in the skin. It's increasing the neoprocollagenesis. So all those things create that skin turnover so that you keep your skin looking healthy, because we're always getting older. I always think from the time we're 25, we're turning from a grape into a raisin. We just can delay that process. And to me, one of the best ways to do that is with carboxy therapy and with the CO2 lift gel carboxy therapy.
Yeah, it's so much better. And I think millennials are getting that message. Is it's so much easier to prevent wrinkles and prevent sagging and prevent turning into a raisin. It's so much easier to prevent it instead of treating it, of starting early and maintaining.
And the thing too, Amy, is that there are a lot of things out there on the market. I can imagine how confusing it is for people. They're seeing so many things that have value and that work. This is how I always break it down. We can get to Japan on a boat. It will take a very long time, but you will eventually reach, or you could fly on a jet plane. To me, the carboxy therapy is the jet plane. It's the quickest way to get to where you want to be. And then to maintain it, really, it's just a monthly treatment to maintain it. But certainly because of our lifestyle, we may want to do it more than like going on a vacation. If people are going to drink more alcohol than normal, why dehydrate your skin in the process? Do a carboxy to kind of reverse that. Or if you're going to be in the sun a lot, obviously you want to wear sun protection and sunscreen and all of that, but certainly do a carboxy. So to me, that's the best thing to take on vacation as well.
Yeah. And you can do it year round versus some laser treatments and IPLs we recommend not doing in the summertime when you have a tan. And this can be used, year round uh, and at home. In our practice, we also have and I'm going to use the word revolutionized. It has revolutionized our recovery from CO2 lasers and recovery from RF microneedling. We have the Morpheus device. And so now we believe in it so much that it really enhances or speedens the recovery. So we include it with all of those procedures because it's just night and day what it does for the recovery of the procedure.
Yes. And I think that's so important, Amy, because when a patient and it comes into any office, your office, they want to get the results, but they don't want the downtime. They want to get back to their life as quickly as possible. And so I think it's as important for a speedy recovery as it is also in terms of improving even the result of the treatment that you're getting that as well. And you think of this as something that can close a non-healing ulcer, diabetic ulcer, in 8 days. I mean, if you think about that, what other product can you just do that with that's not only healing the skin, but is also now creating all these other benefits that we talked about? In addition, I like combining therapies. So combination therapy just has an exponential benefit versus a monotherapy. So you're using the lasers, which are doing all these things, which are damaging the skin in order to create this, this biostimulation and this, increasing the growth factors. So now you're using the CO2 carboxy in the other end, and it's like a 1-2 punch. You're doing the same thing, but from another angle. So I love that you're combining it together. Not only they're going to get a better result, but they're going to get a speedier recovery.
Yeah. I mean, just like, you used to do weight loss is you wouldn't talk to people about diet without talking to them about exercise. So combo therapy for facial aesthetics, or when we have you back and talk about vaginal rejuvenation is, combo therapy is you're always going to have a better result. So, so we love it in that fashion. You mentioned how it was originally developed for wound healing, and from a doctor's perspective, I also love that there's a lot of data behind your product, and there's published studies and how it was originally used for wound healing.
Yes. Yes. So if you go, I mean, there are really, dozens and dozens and dozens of articles of research that has been done on carboxy therapy because it is old. As I said, it was in the early 1930s that it has been used for the therapeutic uses of carbon dioxide. So you can find all these studies. But one of the things that was very key to the CO2 lift is when we actually did our study comparing it with the injectable application or delivery system. And we saw that what they'd used is something called a video capillaroscopy machine, and they measured what the capillaries are doing under the skin. And they saw that by using the injectable or using the gel application, the CO2 lift gel, is doing the same thing. So it was once we established that it's just another delivery system, then the indications are really, wide. As this other dermatologist said last week, I love what she said. She said that the indications of using CO2 lift carboxy gel is only limited to the imagination of the physician, because really carboxy therapy has such a wide use of applications.
Yeah. In fact, one of my staff actually had an allergic reaction from she doesn't know what and had this breakout rash on her face. And so my skincare specialist said, you should put the CO2 lift on. And I'm not kidding you. It had significantly almost resolved after the removal of the mask. And she showed me her pictures. I'm like, whoa, that was
Yeah.
amazing. So
Yeah. No, Amy, listen to me. I have to tell you. So when was this? Back in 2019. So I go to a lot of these meetings where, obviously they're showing you physicians about this carboxy, just giving a lot more education because so many people are not familiar with carboxy therapy. Anyway, there's this one meeting that they were demonstrating plasma pen. Now, normally at meetings, I don't like to volunteer to do any treatments because I'm working and I have to be, on point. Anyway, they convinced me because they're saying, Lana, they were looking for someone with Fitzpatrick 3 and higher for this plasma pen. And they're saying I could showcase the product, the CO2 lift post plasma. So, of course, I said, okay. Anyway, long story short, it worked incredibly well. But what happened is when he put the BLT on, he didn't clean my face.
That's a numbing cream.
The numbing cream, right? He didn't clean my face. If you see the video, he just basically wiped it and then did the plasma. Think of that energy driving that into my skin.
Oh.
So by the next week, I just started breaking out like as if I had acne. And it was very distressing. They put me on steroids, they put me on all these things. But that was really the issue. So I remember it was November of 2019, and it had so many events to do that season. And one of the doctors said, Lana, what are you so upset about? Just put the CO2 lift, do a loading dose, do 3 to 5 and see what happens. Amy, listen to me. So I did it. I'm like, why didn't I think about this? I did that. And so that was on the Sunday. By the next week, Sunday, I have to send you my pictures. My skin was completely clear when everyone was saying it's going to take a good 6 to 8 weeks to clear up. I mean, so when you tell me about someone at the office with that happening to them, I completely can see that. And that made me it just, the silver lining in all of that was I could say to show someone, look, this is what happened to my skin.
Yeah. Yeah. It's pretty amazing stuff. So now that everybody probably wants this let's talk about like exactly how to use it. How often do I use it? How to do it? So what do you recommend? So far I've done 6 and I just love it. I try to do it once a week.
Yeah. When I start, I mean, obviously this is a while back, which has really changed my skin. I mean, I did 10 because at that time we didn't really know. I just did 10 once a week for 10 weeks. And then after that, I dropped down to doing it every month. Since when I was 49, I'm 50 now, I started doing it every other week. So I'm like, let me just do it every 2 weeks. But ideally, you want to do a series of a minimum of 3. I mean, that's what the studies show. You want to do a minimum of 3 once a week for a minimum of 3 weeks, depending on where your skin is starting from. And then if you can extend that based on, how you want your skin to look. Once you achieve the look you want, then you can go to monthly treatments. And, I think that's from the studies, that's what is shown. In fact, if you do it a minimum of 3 weeks, once a week for 3 weeks, then your skin never returns to the hydration of what it was baseline. It stays around 50 to 70% if you just do it once a month. So that's how the recommended use of it. But it's always done in a series of 3. So then if you do a procedure in your office, you want to again do 3. We had I think I sent you the pictures that I sent you with that particular doctor who did the CO2 resurfacing laser on that patient. If you notice from the first picture, she did 3 before she did the procedure, and look at her skin, how it looked with just the 3. And then she did the CO2 laser, and then she was completely healed by day 6. She did 3 more. So that's you always want to do it in 3s, depending on what you're trying to achieve. You would do it to maintain once a month after you do the minimum of 3. But if you do a procedure like a microneedling or any of what you're doing, even if you're doing them once a month, you still want to quickly heal the skin, you want to do a minimum of 3. Did I confuse you?
Nope, I got it. But
Okay.
When the patient's doing it at home, because in our office post-procedure, we mix it up and apply it for patients. But when patients do it at home, the kit itself comes with 2 packets that
Yes.
don't have an expiration date, but then when you mix them together in a little bowl and stir it up for about a minute, then you take the little spatula and apply it to your face. And I tell people, like, get all ready. So as soon as you mix it, it starts working and it starts releasing that CO2. So you want to be ready to go. You don't want to mix it up and then, I got to go to the bathroom. I got to let the dog out. You want to go ahead and put it on your face.
Correct. And if you notice, it will start gelling if you don't. So definitely you mix it and apply it to the face. And I just want to say that your professional office carries what is called the CO2 Lift Pro, which is a higher concentration than what we have other CO2 lift that's since regularly. So I think that's important for someone to know, that it's better really to get it from their doctor's office. But the CO2 lift, once you mix those two packets, and most people or many people ask, how is it created? The CO2 actually is created. Well, the CO2 is created. There's water in that large packet, and that will mix with the gluconolactone, which is in the smaller packet. That forms a mild acid, and that mild acid then mixes with the magnesium carbonate, and that forms CO2. So once that's mixed, you need to apply it immediately. And then that gel holds the CO2 into the skin for 45 minutes. So the minimum time is 35, but 45 minutes, it won't hurt to keep it on after the 45 minutes, but it's just no more CO2 after really 45 minutes to an hour. And then you just simply peel it off. I think the key to putting it on is to make it thick, apply it, thick, so that you can peel it off and it can go right up to the lash line, right over the eyelids, which I think is incredible because very few things can do that. But I want to also point out for the neck, some people say, Lana, if you were to tell your younger self something, what would you tell them? I would tell Lana at 30 to start really taking care of her neck, right? So I would put the Carbox, as opposed to just stretching it from the face to the neck. Right now, I actually use another packet on my neck and my décolletage because that is a definite area that I want to stay youthful. It's a terrible thing when you see some women, their face looks really good and then their neck will give away their age.
On TV all the time, they have talk show hosts, that type of thing. I'm like, their face is absolutely beautiful, but they completely forgot about their neck. Yeah. And it really ages them. So,
yes.
So you recommend one kind of packet for the face and then, or maybe just a little bit of maybe the jawline and then another one for the chest and neck.
Yes, that's what I've been doing now. And I definitely see a difference as opposed to stretching, because when you stretch it from the face to the neck, it's not really the same thing, Gotcha. So I say anyone 30 and up, you really need to think about your neck, because what can you do for your neck? What can you do? Your neck, you know what I'm saying?
I mean, you really got to pay attention to your neck. So,
yeah.
I mean, we can laser it, we can microneedle it, you can get a neck lift.
Yes. Yes.
So,
yeah.
I will say when I do the vagina one for myself, I will take a little bit of that one and just at least just put it under my eyes. So I do cheat a little bit from the vagina one. So, because I feel like you get a lot in the vagina one. And so.
Well, I tell you, I know we're not really talking about that, but for me, oh my goodness, I put all the way to the perineum. I mean, I want that whole area I'm sorry. Can you hear me?
I can. Mm-hmm.
Yeah. I put that whole area. I want the outer lips, everything just as fresh as possible. So I use the whole thing down there. So 3/4 of it is going inside. And the last quarter, I just use it on there and I just sleep with it. Because
that's what I do too.
Yeah.
So versus this, so there's no extra benefit of leaving it on your face after 45 minutes.
No.
Okay. So kind of like when I condition my hair, I feel like I'm being extra good by sleeping in the conditioner. You're not going to get extra benefit by leaving it on your face overnight.
No, you won't.
Okay.
Just if you fall asleep in it, which oftentimes happens if you lie down, then whenever you get up, you just peel it off. But no, there's no extra benefit by leaving it on.
I will say when I take it off, it's pretty satisfying. I actually feel like in that movie Mission Impossible where they like peel off the face. So that's what I feel like because it comes off in a nice sheet.
Oh my
So
gosh, I love my mouth actually waters during that part. It's like my mouth is watering as I'm peeling it off. Very satisfying.
yeah. So, last but not least, before I let you go, is talking about cost, which is sometimes why I don't like to call it a mask because I know like my girls have gone to the grocery store and bought like dollar masks. And I think when you call it a mask, I don't know. So, I don't like to call it a mask. I like to call it carboxy therapy because
Yes.
I feel like it's a non invasive procedure. But anyway, it costs a little bit more than $1. So let's just talk about the cost of it. And on that note, what your thoughts are. Sometimes I hear people say, "Well, I'm just going to age gracefully," and that type of thing. And like, we don't let our car age gracefully or the paint on our house age gracefully. Like, we take care of that. But somehow along the line, like, at least maybe our generation on up has maybe been taught that like taking care of your face and aesthetics is vain and you shouldn't do that. But, you know, I think, you put your best face forward and that's what people look at and it just makes you feel good. And maybe you can comment on, aging gracefully and the cost of the treatment.
I like your perspective on things. I'm not a believer. I mean, obviously, okay, so aging gracefully. To me, what that means is accepting yourself once you're doing the best you can do for yourself. I mean, so their technology has changed. We're living longer. Why not look and feel our best? And if we can do it with things that are natural, great. And this would be in the realm of natural things. It is not a mask. It is a gel therapy. It's just, I mean, any other way to get CO2 in the skin, you'd have to use an injectable in a doctor's office. This is just a way to be able to do it at home. So I don't call it a mask. It's a gel that can be put on air. I mean, I've heard doctors recommending a woman put it on her nipples to get, we're not even
Hmm.
going into that realm. We'll do that next time. But in other words, it can be applied anywhere on the body. So in terms of aging, I think that we as women or and men too, you accept the yourself once you're doing the best you can for your body. And just as you take care of the food you eat because you want to make sure make sure the food that you're eating is healthy because you want to feel better, your skin is just as important. Your skin is what people look at and that's what interfaces with the world. Why not take the best care of your skin? And certainly the carboxy gel is an easy way to do that. If you did nothing else, I think that that's one of the therapies that you should do that is utilizing your own body's natural response to a natural substance. In terms of the cost, I mean, it's typically it's about $100 is what a doctor's office charges when they're giving a patient, and I think that's very affordable because when people say it's expensive versus what, so we look at a carboxy treat, you look at doing um, let's look at another procedure, let's look at using a toxin. Amy,
Yeah, like
when someone
Botox.
gets a
Hmm.
toxin in their office, we'll say they're getting Botox, what are they paying for that? It's the same, it's on the same line, except that it's doing something different from what this is about skin quality. So you can keep the lines out of your face, but what about if your skin looks like leather? Then what's the purpose of it? You know what I'm saying? So this
Right.
is keeping your skin looking soft, glowy, bring the glow on, healthy. And if you did nothing else, this is what's going to keep your skin as youthful and healthy looking as possible. So it's about $100 for a treatment. I'm not sure what you're charging in the office, but
Yeah.
that's typically what a physician would charge.
Yep, that's what we're charging. And like I said, people love it and find value in it. And we couldn't keep it on the shelves for a while. So until we finally got like, okay, we need to order way more than we've been ordering. So it's just been wonderful. So thank you so much for coming on our podcast and sharing your experience and explaining everyone about the carboxy therapy. So I'd love to have you back another time and talk about the CO2 lift V, meaning
Yes.
V for vagina.
Yes, that's my passion, actually. I would love to. I would love to. And again, I really appreciate you inviting me to your platform. I think this incredible education is so important, especially when there's so much misinformation out there. So I really appreciate you allowing me to come onto your platform and share this information with you.
Oh, thank you so much.
Thank you for listening to this episode of Healthy Her. You can find us on Instagram, Facebook, and the web. Go to www.dramybrenner.com to learn more. This podcast is for general information only and does not constitute as medical advice, the practice of medicine, nursing, or other healthcare services. No patient-physician relationship is formed. The information in the podcast and any references, material, or links are at the sole discretion of the listener and not meant to be a substitute for professional medical advice, diagnosis, or treatment. Listeners should not delay or disregard obtaining medical advice for any medical issue